Good morning. Coming at you live from Florida is the next presentation, Chapter 21.1, Orthopedic Surgery. We talked about bones in class and how they are living tissue and some of the characteristics they have, also some of the functions that they have. Bones obviously create an ability for us to move through their attachments with muscles, ligaments, and tendons. There are your skeletal functions, writing framework, as I said, attaching to muscles, tendons, and ligaments. Protecting organs from injury. Some of our major organs are protected by bone. Obviously, our skull protects our brain, our rib cage and sternum protect our heart and lungs, and that provides good coverage for our vital organs. We talked about types of bone tissue in class, and I'm not going to get too deep into that, but important to know is that the cancellous bone is where the bone marrow is at the ends of the long bones. The periosteum, you'll see those periosteal elevators we have in class, they used to scrape the periosteum and the muscles and tendons off of the periosteum so that they can get a good visual of the bone. That's why we have periosteal elevators. Bone marrow we talked about pretty extensively in class, and the production of blood cells and platelets, red and white blood cells. Red blood cells very important. One thing important to know is, as it says in the bottom paragraph, is that as you get older, your red bone marrow converts to yellow, and when your body sees a big need for red blood cells, it converts back, so it'll go back and forth as it's needed. Often it takes a major trauma or hemorrhagic event to make a big amount of your bone marrow turn. Talked about the different types of bones in class. Remember, the patella is a sesamoid bone. Synovial fluid, and synovial fluid is secreted by the synovial membrane, and bursa are the little small sacs that the synovial fluid is contained in. These lubricate some of our joints that are synovial joints. The sacs cushion the weight bearing and the impact of some of these activities, so when something hits, instead of bone on bone or bone on cartilage, there's a little bit of give with the synovial fluid. At the epiphyses of the bone is where the major bone growth happens, and it's also called endochondral ossification. This is where active bone growth occurs, and if you break that epiphyseal plate, then the bone is not going to grow. Talked a lot about joints. Immovable joints, synarthroses. Very few of these in the body. That's your cranium and your pelvis. That's it. Slightly movable are the joints that have a little bit of cartilage between them. Your spine, your vertebrae, symphysis pubis, and the pubic bones. And women that are pregnant tell me that when your pubic bones actually do move on those joints, it's very painful. Freely movable are your diarthroses. Those are your synovial joints that have those fluid-filled sacs to break the impact and give some cushion to those joints. Ball and sockets, good example of that is your hip or your shoulder. Big range of movement. You can move your arm around well unless you've done some damage to it. Condyloid we didn't go over so much, but your temporomandibular joint is a condyloid. You can move it like a saddle joint or a pivot joint, but you can also just a little bit move it to the side. That's what makes it a condyloid instead of just a pivot joint. Gliding joints are your wrists, how they can kind of glide over, the bones actually kind of glide over one another to create movement. Hinge joints move in only one plane. So your elbow, your knee, you move them in other planes and you've got big problems. We went through joint movement quite a bit, and good ways to remember some of these If you're abducted, you're taken away. So that's a good one. Another one is for plantar flexion. I used to tell my patients to plant their foot on the gas. So it's just like stomping on the gas pedal. A couple good terms to remember the difference between. Remember, flexion is bending a joint, extension, straightening a joint. Not too tough. Mineral storage we talked about a lot, and calcium is very important in the body, and a lot of people don't realize that it comes from bone and comes off a bone and gets built on bone. So parathyroid hormone has to secrete to stimulate those osteoclasts to increase the reabsorption of calcium, and that controls the levels of it. There are some other factors. That is the main factor that controls your calcium level in your body. The other factors are heredity, nutrition, and exercise. Without the right nutrients, we cannot produce bone growth. You need to bear weight enough so that the calcium will be produced at a decent rate. Walking is usually sufficient, like it says. Some people need just a little more than that. Lots of pathological conditions. Rheumatoid arthritis, we talked about a little bit. This is where the body forms a response against itself. The body produces antibodies called rheumatoid factors that fight against the body's own natural antibodies. So you get a little bit of joint inflammation, and as it progresses, it spreads around to other joints, and pretty soon your joints become immobile. And if you've seen someone with rheumatoid arthritis, it's pretty ugly. They get all swollen and gnarled up. Nasty disease. Some other pathologies of the joints that we talked about. Bucket handle tear will look like this on the end, where the menisces are torn and the ends are torn off like a bucket handle that just kind of hang there. Joint mice. I have joint mice. If anybody wants to feel my knee, there's a lot of chunks where the patella was broken into a bunch of pieces. Those float around and make a lot of noise, but eventually they'll lock up and cause an operation. Some other pathologies. Osteomalacia is rickets in children, and that's where the bone is losing calcification and softening. Osteomyelitis is an infection. Often the culprit of osteomyelitis is Staphylococcus. Sometimes it's something else, but that is the main culprit of osteomyelitis. If it progresses, it can be a really bad thing to have a bone infection. Think about someone removing your bone because it's infected. Osteoporosis, decreased bone density due to lost calcium. This happens as you age. Bones become fragile and brittle. Bunions, another name for bunions, exostosis. Hallux valgus, outward turning of the great toe away from the midline. Hallux varus, going inward. Genu varum is bow-leggedness. The opposite is knock-kneed, genu valgus. Lots of different kinds of dislocations. Remember, the subluxation is where the joint separates. There's not a break in bone or skin, but the joint gets separated, and all those tissues get torn apart inside. If the joint gets completely torn apart, then it's called a luxation. We went through fractures pretty extensively in class. Lots of different kinds. Make sure you know these. These are important to understand, or you will not do well on the examination. Neoplasms. Chondroma is a tumor of the cartilage. Some people get that confused. Chondro, rib. It's a tumor of the cartilage. Giant cell tumors at the epiphyses of the long bones are often seen in that, as it says on the slide, are often seen in that 20 to 40 age group. Osteoma is just any benign tumor of the bone. Generic term. that's the end of the chapter. I hope you guys study well, and we'll see you for the examination. Thank you.